Margaret noticed the changes gradually at first. Her husband of 43 years, Robert, had always been meticulous about his appearance and morning routine, but lately, he seemed confused about simple tasks like buttoning his shirt or finding his coffee mug in the kitchen cabinet where it had lived for decades. What concerned her most were the nights when he would suddenly sit up in bed, eyes wide with terror, describing vivid hallucinations of intruders in their bedroom or strange animals lurking in the corners of familiar rooms. These episodes, combined with his increasingly rigid movements and occasional tremors, prompted Margaret to schedule an appointment with their family physician, beginning a journey that would eventually lead to a diagnosis of Lewy Body Disease. Lewy Body Disease represents one of the most complex and challenging neurodegenerative conditions affecting millions of individuals worldwide. Named after Friedrich Lewy, the German neurologist who first identified the characteristic protein deposits in 1912, this disease encompasses two primary forms: dementia with Lewy bodies and Parkinson's disease dementia. Both conditions share the hallmark pathological feature of abnormal alpha-synuclein protein accumulations, known as Lewy bodies, which form throughout the brain and disrupt normal cellular function. These microscopic deposits interfere with the brain's ability to produce essential neurotransmitters, particularly dopamine and acetylcholine, leading to the diverse array of symptoms that make Lewy body disease so distinctive and often misunderstood. The clinical presentation of Lewy body disease differs significantly from other forms of dementia, creating unique diagnostic challenges for healthcare professionals. Unlike Alzheimer's disease, which typically begins with memory problems, Lewy body disease often presents with a complex triad of cognitive fluctuations, visual hallucinations, and movement disorders reminiscent of Parkinson's disease. Patients may experience dramatic variations in alertness and attention throughout the day, appearing completely lucid during certain hours while becoming confused and disoriented at other times. These fluctuations can be so pronounced that family members often describe their loved one as having good days and bad days, not realizing that this variability itself is a cardinal symptom of the condition. Visual hallucinations represent another defining characteristic of Lewy body disease, occurring in approximately 70 to 80% of patients. These hallucinations are typically well-formed and detailed, often involving people, animals, or objects that appear completely real to the affected individual. Unlike the frightening or threatening hallucinations sometimes associated with other psychiatric conditions, those experienced in Lewy body disease are frequently benign, though they can certainly cause distress for both patients and their caregivers. Patients might report seeing children playing in their living room, deceased relatives visiting for tea, or small animals moving through their home, experiences that feel entirely authentic despite their unreality. The movement-related symptoms of Lewy body disease closely mirror those seen in Parkinson's disease, including bradykinesia, slowness of movement, muscle rigidity, and tremor. However, these motor symptoms in Lewy body disease often respond less predictably to traditional Parkinson's medications, and patients may experience significant side effects from dopaminergic treatments. Additionally, individuals with Lewy body disease frequently develop a characteristic shuffling gait, increased risk of falls, and problems with balance and coordination that can significantly impact their daily functioning and independence. Sleep disturbances represent another crucial component of Lewy body disease, particularly REM sleep behavior disorder, which can actually precede other symptoms by years or even decades. During normal REM sleep, the body naturally becomes paralyzed to prevent us from acting out our dreams. In REM sleep behavior disorder, this protective mechanism fails, causing individuals to physically act out their dreams, often in violent or dramatic ways. Patients might punch, kick, shout, or even jump out of bed while remaining asleep, potentially injuring themselves or their sleeping partners. This symptom can be one of the earliest indicators of developing Lewy body disease and serves as an important diagnostic clue for neurologists. Diagnosing Lewy body disease requires careful evaluation by specialists familiar with its unique presentation, as no single test can definitively confirm the condition. Physicians must rely on clinical criteria that include the presence of progressive dementia, along with at least two of the three core features: cognitive fluctuations, visual hallucinations, and Parkinsonism. Additional supportive features might include severe sensitivity to antipsychotic medications, repeated falls, syncope, transient episodes of unresponsiveness, and the aforementioned REM sleep behavior disorder. Brain imaging studies, including DIT scan, dopamine transporter scan, can help differentiate Lewy body disease from other forms of dementia by revealing reduced dopamine activity in specific brain regions. The progression of Lewy body disease varies considerably among individuals, but it generally follows a more rapid decline compared to Alzheimer's disease. Cognitive abilities may fluctuate dramatically from day to day or even hour to hour, making it difficult for families to predict their loved one's functional capacity at any given time. This unpredictability can be particularly challenging for caregivers who must constantly adapt their expectations and support strategies. Some patients may maintain relatively preserved memory and language skills while experiencing severe problems with attention, executive function, and visuospatial abilities, creating a unique cognitive profile that distinguishes Lewy body disease from other neurodegenerative conditions. Treatment approaches for Lewy body disease require careful consideration of the complex interplay between cognitive, motor, and behavioral symptoms. Cholinesterase inhibitors, commonly used in Alzheimer's disease, often provide significant benefits for cognitive symptoms and may also help reduce hallucinations in Lewy body disease patients. However, the use of antipsychotic medications must be approached with extreme caution, as individuals with Lewy body disease demonstrate heightened sensitivity to these drugs, which can cause severe complications including worsening of motor symptoms, sedation, and potentially life-threatening neuroleptic malignant syndrome. Managing the motor symptoms of Lewy body disease presents unique challenges, as traditional Parkinson's medications may provide some benefit, but can also exacerbate cognitive symptoms and hallucinations. Healthcare providers must carefully balance the potential benefits of dopaminergic therapy against the risk of psychiatric side effects, often requiring frequent medication adjustments and close monitoring. Physical therapy, occupational therapy, and speech therapy play crucial roles in maintaining function and quality of life, helping patients develop strategies to cope with movement difficulties, swallowing problems, and communication challenges. The impact of Lewy body disease extends far beyond the affected individual, profoundly affecting family members and caregivers who must navigate the complex and often unpredictable nature of the condition. Support groups, educational resources, and respite care services become essential components of comprehensive care, helping families understand the disease process and develop effective coping strategies. Research continues to advance our understanding of Lewy body disease, with ongoing studies investigating potential biomarkers, improved diagnostic techniques, and novel therapeutic approaches that may one day offer hope for more effective treatments or even prevention of this challenging neurodegenerative condition.